My name is Mario Abdennour. I'm an endodontist. I went to Washington University School of Dental Medicine for dental training, and currently I'm an instructor at the Harvard School of Dental Medicine in the Department of Endodontics. I'm an endo instructor, clinical instructor, and I went to that school as well for my specialty in endodontics and my master's in oral biology as well. Well, I practice endodontics full time, so we try to save teeth in endodontics, but sometimes we can't. And as I do a lot of endodontic surgery, I think that's the time to place an implant if the tooth is going to fail, obviously. Basically, I have observed the procedure many times, and that's basically it. And I found that the course today was very helpful, was very targeted, was exactly what we needed, and it did advance, at least in my opinion, my knowledge. It was, I believe, Dr. Raymond gave a fantastic lecture that was very precise and well documented as well. Well, the hands-on experience in vitro, meaning on the mandible, on the plastic mind, was fantastic, and today clinically was amazing. The instructors of this particular group they are fantastic. They're very, very nice and very knowledgeable, all of them. I know I'm safe in very in a lot of basically environments, or in a lot of cases, and also because of my microsurgical experience, it makes it a little easier for me. But yes, I would love to place it. It's very advantageous, and it always leaves you with room to learn more. It was absolutely enjoyable, and it was not boring at all. It was great. I enjoyed it. I would definitely recommend this course. About the implant system that we learned, the Neodent implant system is very precise, in my opinion, very predictable, and basically all the different things that you can do in implants have been reduced to the minimum. So I think it's a very efficient and very easy to learn system.